Knowledge is the best antidote for fear of the unknown. Hello, I'm Dr. Peter Orner. I'm a board-certified internist and professor. I'm also an expert in injury causation, much like the CSI stuff on TV, but for real. I am concerned about, but not fearful of, the Ebola virus. I'd like to share the next 20 minutes or so discussing a few important facts and some of my thoughts about how Ebola does or does not affect us. I'd like a chance to help you understand Ebola in the United States without fear and panic.
We're in the midst of an Ebola scare. A few days ago, the San Diego Union Tribune published on their website a scare headline, "Panic and Fear Grip San Diego," after a student from a nearby university said that she had been on an airplane with an Ebola victim and that after she got off the plane she vomited. The headline disappears 2 hours later after the student confesses to a hoax. In New York City, a man wearing a surgical mask departs from a bus saying, "Don't mess with me, I have Ebola," and then disappears. However, the bus driver is hustled off to quarantine. Again, nada. We are not yet in full and total panic mode, but the politicians, pundits, and media, or at least some of them, are trying to push us there, because that's what they do. The term airborne is much talked about by media, pundits, and politicians, mainly to discredit the government's apparently contradictory statements that first, the virus is not airborne, and then later, you better stand 3 feet away from an Ebola patient, per the CDC. Airborne in this context means borne by the air. In other words, floating through the air like weaponized anthrax, very small and very light particles meant to float through the air on drafts like little soaring birds. Ebola is not anthrax. It travels only on bodily fluids and materials which leave the confines of the body, such as sputum, blood, urine, semen, fecal matter, vomitus. Bodily materials can leave the body as clumps of fluid or solid, or as drops or an aerosol. An aerosol is a collection of small drops, essentially a fine version of a mist, such as you generate when you press the button on a spray can of deodorizer. Obviously, a violent and forceful cough could expel droplets or mucus or whatever more than 3 feet. 2 people can easily touch and directly exchange biological matter when 3 feet apart. If everything else is the same, taller people can cough, spit, sneeze particulate matter farther than can a short person. That's how it is because of the laws of nature, including the law of gravity. Should we have special tall person regulations for sitting on trains, planes, and buses, or standing in a lobby of a theater? Droplets will fall to the ground under the force of gravity. They will not float around the room like miniature gliders. Aerosols can stay aloft longer, but if they have not evaporated, will then drop to the ground as well. A bit of semantics is in order here. Infected means you have the bug or virus and are sick and symptomatic. Infested means the virus or bug resides somewhere in your body, but you are not sick and you are not symptomatic. In other words, you are asymptomatic. That is a big and important distinction. A host, or so-called vector, is an animal which carries a virus, bacterium, or parasite and then transfers that organism to another animal. For example, a certain mosquito is the host or vector for the malaria parasite, which it then transfers to human beings. Non-direct contact transmission of the Ebola virus has been known for at least 20 years. In 1995, Lancet, the British medical journal, reported on monkey tests showing that the Ebola virus could be transmitted from monkey to monkey in the laboratory without direct contact. Healthy and infected animals were put in nearby separate cages. Neither monkey could touch monkeys in the other cage nor touch the other cage. Some of the healthy monkeys came down with the Ebola virus disease. It was not determined exactly how the virus was transmitted between cages. It could have been by aerosol transmission in the lab. Infested but otherwise asymptomatic people cannot pass the virus to other people, since virus shedding, that is sending virus particles outside of the host body, occurs only in symptomatic individuals. The 3-foot zone stated by the CBC is for public consumption only. It has no scientific meaning. The echoes of a 3-foot zone, however, come from politicians such as Senator Rand Paul, who also said that Ebola is transmitted like AIDS, and other assorted pundits and politicians. It is meaningless political hype. By the way, Dr. Paul is an ophthalmologist, not an internist or engineer. Ebola infection has been accomplished in a laboratory by blowing virus into the lungs of lab animals. However, based on studies of Ebola epidemics, the principles of physics, and testing with monkeys in the laboratory, it does not appear that aerosol transmission is an important factor in the real world. Of course, scientifically challenged talking heads and politicians will say otherwise. The established routes of entry are directly into the bloodstream, as through broken skin or wounds, directly through mucous membranes, as in the eyes or mouth, and by ingesting infected meat. Studies in or other infected substances. Studies in lab animals have suggested that in the laboratory, blowing the virus into the lungs is less lethal than direct contact with those same lab animals. It should be noted that for effective airborne transmission, an aerosol would have to be manufactured into very small, lightweight particles, otherwise known as weaponization. More on that later. Bottom line, the main transmission of Ebola is from direct contact. It is unlikely that infested but asymptomatic individuals actually pass the virus to healthy individuals by the airborne route in the real world. Minimally symptomatic people carrying the Ebola virus might pass the virus. Perhaps that's one way we develop Ebola antibodies and immunity in the real world. And we do that. Maybe wearing masks in the mall is not such a good idea. Of course, bets are off in the case of a markedly symptomatic infected individual, either us or them. By the way, if you're wondering about terrorists using Ebola for biological warfare, yes, that has been studied for over a decade by the US, Russia, and probably some other people. HFVs, hemorrhagic fever viruses, of which Ebola is but one, have been studied. However, it requires very expensive and very specialized equipment and knowledge to weaponize the virus to allow it to flow through the air and remain potent long enough to intentionally kill human beings. Ebola has been around for a long time. It is not a new viral scourge. Perhaps the first outbreaks were in Zaire and Sudan about 40 years ago. About 300 cases appeared in each country with a very high mortality rate. Go to the excellent CBC website for more of this data and other information about the history of Ebola outbreaks. Google CDC Ebola timeline. The Ebola virus is believed to have originated in fruit bats and is hosted in the wild by monkeys and other animals. Humans and doggies are domestic hosts for the Ebola virus. The Ebola virus will always be there in the wild, just like wildfires are there. What we hope to do, and about all we can hope to do, is to keep it away from us, just like wildland firefighters try to keep wildland fires away from us. You can self-vaccinate, or more correctly, self-immunize against Ebola by having contact with an infected person but not developing the disease. Lots of luck. Do not try this at home. Those old enough can remember chickenpox parties wherein mom took her uninfected kids to the house, usually in the neighborhood, of a child with chickenpox so that her children could be self-immunized against chickenpox. I'm telling you this because it is a very important factor in limiting the progress of epidemics, and specifically something like an Ebola epidemic, since more and more of the survivors of the epidemic will be immune to at least that strain of the Ebola virus. A World Health Organization in Sudan in the early 1980s showed that about 20% of the population surviving that outbreak of 1976 had antibodies to the Ebola virus. That also means that Ebola virus infection, not just infestation, but infection, can be subclinical. Translation: minor symptoms or none at all. That also means that Ebola infection of a population cannot continue unrestrained like the invasion of the body snatchers or a zombie attack. Ebola is not the scourge which is about to destroy the world as we know it. To put things in perspective, the Spanish flu of 1918 was caused by a virus which killed on the order of 5% of the total world population, which is about 1.5 billion at that time. The death toll was estimated at between 50, that's 50, and 100 million individuals. The death toll in the United States alone was estimated at 10,000 deaths per week. Bottom line, Ebola is not the Spanish flu. The Spanish flu did not wipe out the world. Ebola will not wipe out the world. Not all that vomits is Ebola. In medicine, it is taught that it is perhaps more important to know when not to treat. For example, when not to give an antibiotic for a sore throat, which is probably caused by a virus anyways. The double whammy is that the treatment, besides being medically worthless, is actually harmful. All it does is encourage the growth of resistant bacteria, which are causing no harm to the patient. Bottom line, The knee-jerk reactions to close the borders, close schools, quarantine everybody that even maybe was in contact with an unproven case of suspected Ebola contact is very destructive and won't work anyways. Ebola is a significant public health problem. Public health problems are handled by the governmental public health agencies, such as NIH and the CDC. Our CDC is perhaps the best institution of its sort in the world. Public health problems are often poorly understood by the public and seized upon as talking points by politicians, to put it mildly. Don't believe what you read or hear from the media on this point, especially the social media, which reacts with the speed of light without waiting for that light to illuminate us with knowledge. The popular media, including both print and the internet, can really screw things up badly. Do get your information from reliable sources like the CDC, NIH, and legitimate medical sources such as medical journals. Most of these reliable medical sources have free internet access. WebMD is an easy to understand example. The JAMA, Journal of the American Medical Association, pronounced JAMA, spelled J-A-M-A, is a little more advanced, but definitely worthwhile taking a look at. Google JAMA, that's J-A-M-A, Ebola. The CDC is where it's at for reliable information for those who really are in the know. Google, I should say that it's a place to get the information from those who are really in the know. Google CDC Ebola and follow the links for some really good up-to-date stuff. Most of what you see is written for ordinary interested human beings. Some is more technical. JAMA and the CDC are way more objective than Fox News. You'll see that the CDC and others have been diligently pursuing Ebola vaccines for over a decade, and what the actual medical problems they encountered then and now are. By the way, that work has been slowed down by the cuts in CDC and NIH funding since well before the present crisis. Thomas Duncan is the first and only fatality from Ebola in the United States. He did not develop his Ebola here. He brought it in from Liberia. There have been several cases of presumed infestation due to contact with Mr. Duncan. None have panned out. Some have already passed through quarantine, have been cleared, have remained asymptomatic, and are home. There have been a couple of cases of confirmed secondary infection due to contact with Mr. Duncan. None have been seriously ill or died. Clearly, Mr. Duncan did not start an epidemic in the United States. If another Duncan case appears, that does not mean that our surveillance or prevention methodology is inadequate and or incompetently run, as some would have you believe. It's going to happen. We are human beings. And if other cases of secondary infection appear in health workers, that does not mean that our treatment and personnel protection methods are inadequate or incompetently applied. It's going to happen. We are just human beings. Stuff happens, regardless of our best planning. That's what happens in wartime. We simply do our best, and I believe that we are doing just that. We are just human beings. Despite the blather from talking heads and politicians. But we are still in a neo-panic. That's incipient panic mode. Each new presumptive case raises the level of public anxiety and fear. Borrowing from Franklin Roosevelt when he said, "We have nothing to fear but fear itself," we are vulnerable to the fear of Ebola, not the virus of Ebola. Bottom line, Ebola is not an epidemic in the United States. It is overwhelmingly probable that Ebola will not become an epidemic in the United States unless we do something really stupid, like trying to isolate Africa from travel to or from the rest of the world. Thank you for listening.